Welcome to the Progress Report. I'm Sarah B. Nelson, your host and Chief Design Officer here at Kyndryl. We have an exciting episode today where we're going to talk about how AI is transforming healthcare. And in particular, we're going to look at the way AI can embolden us to think differently about things like patient experience, about relieving some of the burdens for clinicians so they can get to patient experience, and also to look at how data and connecting data in new ways that weren't possible before. Joining me today is Dr. Kris Lee. She's the Associate Executive Director and Chief Transformation Officer for the Permanente Medical Group, which is part of Kaiser Permanente. And we also have Ambe, who is Kyndryl's Senior Vice President and Managing Director for Healthcare and Life Sciences. So welcome, Kris and Anu.
Hi, good morning. Thanks for having us.
Thank you so much, Sarah. Nice to be here with you both.
Fantastic. I'm really looking forward to this conversation very much. So I want to just get right in. So Kris, first question I have for you is if you could tell us about your journey into healthcare and healthcare technology. And I'm particularly interested in how your experiences as a clinician have really shaped the way that you think about how the systems between clinical care, healthcare administration, and all of these increasingly digital systems, how all of that works.
Yeah. Well, it's been a very interesting journey, not the most straightforward one. I've been a practicing primary care physician for 21 years now and have held various leadership positions, solving, all kinds of different clinical problems, and really being becoming sort of more of an expert at operations. And when I was asked to help start supporting our technology teams and sort of creating our AI strategy, that's always everybody wants to talk about AI. They asked me to do that. And I was like, oh, okay, well, I don't actually really know anything about technology or AI. So I do feel that in the past 3 years in this role, I've had to learn a lot. And I've also, one great thing that I've learned is that I bring a completely different lens into the space. And so not every problem is a technology problem. Not every problem can be solved by AI, by the way, because everybody kind of thinks that it can be. But really thinking about just different ways to incorporate technology into either daily workflows or to help our patients be healthy and stay healthy. That's really been my journey.
So Anu, I'm actually curious about the same with you. Like, what is your journey into this space been like?
So thank you, Sarah. Unlike Kris, I was born and raised in IT, information technology services, and really proud about the journey I've had. I come from a family of physicians and specialists. So it was very common to have dinner conversations about how hard it is to provide care to patients and how hard clinicians had to work and how much time they spent doing non-patient work. And so as a technologist, I was always curious about how can we make that better? How can we make that workflow go smoother?
It's interesting to hear how both of you moved into it. So something you said, Kris, and I just want to, knowing that AI is not the solution for everything, and what are you seeing where are you seeing AI deliver the most impact today?
What I've learned over the past few years is that I think there's tremendous potential and there's also tremendous risk, right? With, either automating things or using AI in different things. Really, if we think about healthcare specifically, we are a highly regulated, safety always first, right? First, doctor do no harm, right? And so when we think about deploying AI in healthcare, there's always this sort of risk assessment that needs to happen. So I sort of quantify it in, the lowest risk use cases of AI are things that are going to improve our efficiency or help us with automating some of the administrative tasks that we have to perform every day with every patient or with every encounter. And I think the highest risk use cases of AI would be anything that's patient facing without a human in the loop, right? So if it's like, oh, we're going to build or some use of AI that's going to be helping to make clinical decisions, right? And it's facing the patient, without a doctor in, I would say that's the highest risk area, and everything else is kind of in between. So we've really started, not surprisingly, at the low risk end, as we're also learning all of our systems, we also have to think about how all of our legacy technology works with the new anything that we put in, and that can be very complicated too.
So let me tell you a story, right? I was talking to Kris about it, and I was saying, when I go into a physician's office, I kind of observe how the care process flows through the journey. We're all excited about tech stacks, and we want to bring in this technology and that technology. And I'm sitting there thinking, oh my God, the caregivers are spending so much time in documentation and administrative activities, which to Kris's point is probably lower risk compared to actually doing AI, which is more intrusive. But if we could just take that burden away, we free up so much time, whether it's the nurses, the physicians, the specialists. And, that's just one area, right, that I observe. The other piece is around decision-making support and how we can help improve that piece. Is another area that I've observed, right? As long as we are able to take care of the risk, the regulation, which is kind of foundational, right? No matter what you do. And we are able to identify the right use cases, we then start to give time back to these caregivers so that they can actually bring the human aspect back into care versus me having to stare at someone who's typing into the computer when I'm speaking, right? So that is kind of how I look at things, and we have this opportunity. And I strongly believe that technology and the business, which is the caregivers and the technology teams, need to sit down and co-develop these, because the perspective you get when you're sitting in their shoes is completely different.
Can I put a little exclamation mark at the end of what you just said? Because that is so right on, Anu. A little statistic, right? Because I've actually studied this. One of the problems that I've been trying to solve is around physician burnout and clinician burnout. We, following the pandemic, went through the Great Resignation, just like every industry went through the Great Resignation. And one of the saddest things that I had to watch were people completely leaving healthcare, just saying, I can't do it anymore. I'm no longer going to be a nurse. I don't want to be a doctor anymore. Doctors are spending, for every 1 hour of direct patient care time, that generates 2 hours of administrative work. So doing that math, right? Well, number one, I didn't go to school saying, oh, sign me up for that. That sounds great. No, I want to do the direct patient care. And that sort of ratio is only, broadening as more and more things come in that we have to do. So I absolutely love what you said, Anu. And I think you should come over here, come to KP.
Yeah. I was actually going to also exclamation point that too, just sort of like human-centered designer is that, what is their actual experience like? And actually that's kind of, I'm curious then, this going down that sort of the clinician human path. I'm curious how is that, what have you heard clinicians say about the digital technologies and some of these changes that are coming down?
So as Anu was saying earlier, there are a lot of solutions out there. This is also one of the problems. Everybody has to have 2 screens now. You can't have 1 screen anymore. So now I'm adding screens in between me and the patient. Some things are on the phone, some things are here. So how things are integrated into the workflow matters. If I have to jump out of the patient's chart for any reason, that's already a painful experience. And then are the things talking to each other and helping each other, or do I have to duplicate something over here and then cut and paste something or import it or whatever? These are all just like these pain points that happen. And we were talking about there are thousands, right, of these different solutions, but how are they working together in service of what the clinical team is trying to do, which is just let me help you.
And one of the things we say in user experience is that people spend 99% of their time on a application that is not yours. So that whole like to your point, thinking about how that entire universe comes together, and I imagine they're doing some of that with the patient in the room. So they're having to multitask, think about the actual clinical content, navigate a conversation. So what are, I mean, I'm curious, like at Kaiser Permanente, what are some of the things that you've rolled out that are successful or not? I'm curious about like tests that you've done or prototypes or even just big transformation.
Yeah, probably the biggest one at the largest scale was rolling out the ambient AI scribe technology. So back to the original problem, me trying to solve burnout. I started by first surveying all of the clinicians, and they said that it was in-basket management. So the inbox management was the number one driver of the burnout. And so then looking into the in-basket, I was like, okay, well, what aspect of the in-basket? Because there's so many different, pick a folder, there's dozens of them. And people were spending the most time after hours. So this is time when I'm at home, supposedly eating dinner with my family or reading, a book to my little guy, documenting notes. And so that became clear to me that was the first problem. That was a place that we could solve. And using the ambient AI scribe technology has really made a huge impact on the well-being of our workforce. So, we see turnover rates are down to pre-pandemic baseline levels. In fact, they're the lowest they've ever been. I can see in the data, people are getting that time in the evenings back, and they're getting that wellness time back again into their day. We have direct quotes from physicians and others that are using the technology, and patients that think this is the coolest thing since sliced bread. They love being able to actually see their doctor, and I love being able to see my patient and I don't have to worry about typing anything or dictating something later. I know that the technology is picking up our conversation and will help me write a clinically relevant note that is accurate to put in the charts. We have a really exciting pilot that we're doing now too.
Let's just go with that for the moment. What's the pilot?
Exciting pilot. Okay, so again, I'm always starting with what is the problem that we're trying to solve. Kaiser Permanente is very well known for having the most amazing population management health programs. So, we'll identify like, okay, in our 4.7 million patients, that we have these many patients who have diabetes, and then programmatically helping to take care of diabetes, right, in this population of patients. And one thing that we're hearing, especially with our younger generation of patients that are coming through, is that they want to have personalized medicine. And so personalized medicine becomes a much more difficult challenge to handle. I, Dr. Lee, can personally handle one person at a time, right? And so the pilot that we are running right now is with digital twin technology. So using remote wearables, we're partnering with a vendor and doing a research study on this in 2,000 patients in Northern California, creating a digital twin of your metabolism. Can you believe that? I don't know if anybody listening to this podcast has ever studied metabolism, but it is a crazy convoluted map of things, horrific things like the Krebs cycle that, we have to memorize in school. Incredibly difficult. But by creating a digital twin of someone's metabolism, then you can start making very personalized recommendations to that patient, that is specific to them. So this is a test really in sort of precision medicine and coming up and complementing our population health management schema.
I'll just say personally, I would That sounds amazing. I would love to have insights like that. Anu,
I can sign up for your pilot. I can sign up as a patient.
This is my email traffic nowadays is like, how do I get one of these? Everybody wants to get it there.
So Kris, it's interesting from as you're describing the digital twin and all of this data, it puts me back in mind of some things you said earlier, which was about data security, high regulation as a regulated industry. Then you've got sort of trust and the systems, all of that complexity. And Anu, it strikes me that this might be something that you've thought a lot about.
Healthcare is very different. There's literally life at stake here. And so Kris touched upon this earlier, which is making sure we have the right security architecture for AI or automation or any other technology to run is very, very foundational. Every system is at a different point in the journey. But I believe that, there are ways by which we can solve a lot of these challenges. I also believe there's opportunity in attacking some of the administrative burden. But if I put myself in the shoes of the patient, one of the very interesting use cases is around denial prediction and prevention. And a lot of the times the hospital system cannot give care because you'd still have to go through that process, right, with a payer. And, that's a complex workflow, right, to be able to figure out the process and navigate and apply AI. And so when you're studying patient flow without your IT cap on, you're actually going across multiple sets of applications and the data is not sitting in this one little place, right? So if you put all of that together, there is a way by which we can think about solving security. We can then solve the data piece, which is what's the right data architecture and approach from an IT perspective. Once you've kind of done that, then it is about how do we prioritize some of these unspoken use cases, which can bring a lot of benefit to much smaller hospital systems.
I just love everything that you are saying, Anu. It's like speaking straight to my heart. Several things around the data, right? So we had talked a little bit about data, so much data, especially in healthcare, but it's sitting in different platforms. It's sitting in different places. And as we're thinking about leveraging our data, right, to be able to train an LLM or whatever it is that we want to do with it, we have to be able to access it. I'm still learning a lot in this space, but what I've learned and I have so much appreciation for is how complicated actually just doing that. It sounds like it should be very easy, but it's not. So if there's anything you can do to make that easier, guys, please bring it on.
Again, I just kind of keep coming back to the underlying complexity and then how that impacts the direct interaction. Because the people interacting with it, actually, they don't care where the data comes from.
And they don't. Anu was talking about sort of the flow of the patient. The patients don't see it like, oh, well, that's a rev cycle thing. They don't see that, right? They only see, oh, this is all of Kaiser Permanente. So it's not only me taking care of, integrating with legacy technology or whatever. I have to integrate workflows and teams of people so that it feels like the seamless journey for the patient. Anything that we can do to increase flow and throughput of a patient through the whole system, costs will come out. Things will get better. But multiple integrations across multiple different groups of folks, right?
I want to just add something. We're doing a pilot. Actually, we're just trying to kick off a pilot, and this is also digital twin, but in a slightly different context. So the COO of one of the hospital systems, actually really such an intelligent person, he said, Anu, when a patient walks into the emergency, do we ask them to open a ticket? I'm like, no, you just like wheel them in and get care delivered, right? And he said, so my vision is when a clinician has a problem with a device, whether it is a handheld device, whether it's a workstation on wheels, or simply, one of these IT devices which, they need to work and function. So his challenge to my team was, hey, is there something we can do to solve that problem for the caregiver experience? Because all they want to do is that when they want to use a system, it actually works. And so I'm actually we are in the norming forming stage of what the pilot looks like. And the idea is to take that and do something proactive. So, you don't need the clinician to ever have to open a ticket. And so this notion of proactive and predictable is something that we are starting to work with, because even though we are in the infrastructure domain and the application domain, it's so important that we can strive towards making it seamless.
So actually, I think you've both kind of pointed in this direction as we start to look ahead. So you've got pilots going. There's lots of work of trying to figure some of these things out. But when AI is truly working in healthcare, when it's like invisible, what does it actually? How is the experience different?
What I would hope for, if everything was perfect, is that all the friction is removed out of the system. There are so many friction points facing clinicians every day, and I'm sure facing the patients. And when patients feel friction, they will often turn to me, Dr. Lee, to say, hey, Dr. Lee, can you help me? I'm trying to pay my bill, and I don't know if my insurance says I'm covered for this or that or whatever. I have no idea what your insurance is covering you for, but I sure do know how to take care of your high blood pressure, So for me, what it would look like is these friction points just dissolve, and everybody's working to the top of their scope and able to do their jobs, take care of people.
I think for me, the final outcome is if doctors can get back to the human touch into care and focus on that versus worrying about filling forms and the paperwork and all that, to me, I think that is sort of one thing we need to think about. I'll give you a few examples for me, which if that goes away, it's heaven. If a patient has to wait for 6 months to get a physician appointment, and if that can be less than, let's say, 3 to 4 weeks, if a person knows that they have cancer and they need a specialist to operate on, and they still need to wait for 2 months, that's a problem. And so I think the ultimate success, the measure of success, is not an IT measure. It's not necessarily just efficiency, productivity, but it is about how are we actually bringing the human touch back into care, and how are we able to make care affordable, because we are also focusing on making sure we can take the cost of care down.
So we always like to end these podcasts discussing what progress looks like. So Kris, curious for you, what does progress look like?
If I had a magic wand, I would love to stop being point solution to death. That's one, because it takes up a lot of takes a lot of energy out of the teams and out of just our brains, to be, okay, here comes another one. And really for it to be thought of more holistically from the standpoint, what Anu was saying earlier, being right there with us to understand deeply, like come hang out with me so that you can understand the problems that I'm trying to solve and then help me solve them. That would be just amazing. So to me, that would be progress. I also think, hey, if I needed a measurable, right? Like, I need a KPI or something like this. It would be our ability to take care of more patients. I would love to see decreasing turnover, decreasing burnout amongst the teams. I think that would be progress too. And we work on these every day, but that would be my magic wand wish.
And Anu, what does progress look like?
As a technologist, I think we do a lot of things in the back room, as I call it, right? Whether it's data centers or infrastructure or apps or all that is great. We need to do it, and there's a place for it, and it's really important. But I think what I am really proud about is if I can execute programs where we are able to bring the best of technology to solve some of these real world problems for our caregivers and our patients, that's success for me.
Excellent. Well, thank you, Kris and Anu, for joining us in the Progress Report today. This has been a fantastic conversation, and I wish we had more time to just keep going. So thank you. Thank you both.
Thank you so much.
Been a great host, Sarah.
Thank you, Sarah. Thank you, Kris.
Thank you, Anu.
So thank you for joining us on the Progress Report today. If you enjoyed this conversation, please do share it with your friends. Like it, of course, and you can subscribe to this podcast anywhere you subscribe to podcasts.